Hello, my name is Terry Takai, and I am the Chief Programs Officer here at the Center for Digital Government. I'm so excited to be able to announce our brand new program that I think you're all going to be excited about. Now, we know that Health and Human Services is entering a defining period of transformation that's really shaped by operational pressures, workforce strain, modernization demands, and continually rising expectation among our constituents for service delivery. Across the country, agencies are navigating historic change while working to modernize one of the most operationally complex systems in government.
Greetings. My name is Justin Brown, former Oklahoma Secretary of Human Services. Great to be with you. Thank you for your consideration. From my seat as CEO of Global True North, a public benefit corporation that works in health and human services transformation, and my experience leading the human services system in Oklahoma, it is clear that there are operational pressures that can force organizations into constant reaction, or they can be the catalyst for long-term transformation. It's a posture of defense or offense. And it is my belief that we can be intentional and choose which position from which we operate. The leaders that are making the greatest progress are the ones creating space to think beyond the immediate disruption and start shaping what HHS should become over the next decade. The future of health and human services is being shaped right now, and the organizations helping define it will shape the next decade of transformation in America's most important system.
And Justin, that's why we are partnering together to launch HHS 2030. This is a long-term leadership initiative. It's really been developed by Justin's organization, Global True North, in partnership with governing and government technology. And our plan is to help shape the future of health and human services over the next 4 years. This initiative brings together senior HHS leaders and select corporate members to work through today's operational realities while helping define the future of that HHS transformation that Justin just talked about. Participation is intentionally limited to organizations committed to helping shape the future of HHS alongside government leaders.
HHS 2030 is really built by a group of former secretaries, directors, commissioners, and other partners to ensure that the conversation we're having over the next few years is transformational and strategic, while also identifying those core areas of urgent conversation that we refer to as catalyst events. Today, health and human services across America is mostly reactionary. Essentially, when something happens, it happens to us and we have to respond. The intent here is to build a long-term conversation on transformation and use those current moment events as catalysts to accelerate towards that transformational change. What does HHS transformation actually mean? What does it look like? The group of former HHS leaders who are working to build the strategy for HHS 2030 have identified 7 core focus areas. Those are culture, leadership, and talent, systemic capacity, delivery model transformation, policy and policymaker alignment, outcomes and evidence, public, private, and civic alignment, and operational effectiveness. Now, you can read into all of those and we can go much deeper, and we will over the next few years. It's clear that technology plays a critical role in all of those areas. And so this sort of underlying theme of technology modernization is a critical one to point out as well. From a program structure perspective, it's important to note that partners across America will be participating in an ongoing series. In order to define the long-term transformation strategy for HHS, there will be four events that are in person that will occur annually. Between those 4 events will be a series of virtual workshops approximately quarterly in order to take the current urgent moments, these spaces like Medicaid modernization and rural health transformation and error rates, and look at them through the lens of ongoing transformation. So it's important to note that the long-term conversation occurs in the annual events, and the understanding of how to adjust posture in these moments of critical urgent need will be happening on a quarterly basis. All throughout, the intent is to publish white papers and written articles to help contribute to the ongoing conversation of health and human services transformation. This initiative is grounded in the real operational pressures that leaders are managing today. Those pressures change over time, but at the moment, of course, that will resonate to you are those pressures around rural health transformation, work requirements, of course, ever-present error rates, other areas like Medicaid modernization, program integrity, workforce constraints, and service delivery expectations. But the goal is bigger than solving immediate challenges. It's about using those pressures as opportunities to accelerate long-term transformation across health and human services. That's what makes these conversations in HHS 2030 different.
Now, what really also makes HHS 2030 so different is the combination of practitioner leadership, trusted executive relationships, and a long-term transformation model designed to evolve over time, because we know the winds of change are not going to stop. This is an ongoing working forum where government leaders and corporate members collaborate around the operational and modernization challenges actively reshaping HHS. Together, participants are helping to really move from those immediate priorities that agencies face and be able to move each year through to that longer term future.
For corporate partners, the value is meaningful participation in conversations shaping the future direction of health and human services. It's the opportunity to engage alongside leaders navigating real operational and modernization challenges while building long-term strategic alignment around where agencies are heading next. The organizations that engage early will be better positioned to understand where HHS transformation is heading and to build long-term strategic relevance in the market.
So to sum it up, health and human services organizations are entering a defining period of transformation. It's not just about each of the short-term actions and winds of change, but it's really about rethinking where we're going to be for the future. HHS 2030 is the opportunity to work alongside the leaders that are redefining that future. But it's also about building long-term strategic relevance and long-term strategic partnerships in one of the most important markets in government.